Are you bothered by your waterworks symptoms? Have you wondered if you could do anything to stop your prostate from growing and causing you more trouble in the future? Is there any specific diet or lifestyle that you could adopt to reduce that risk? While there are factors that you can't do much about, like a family history, hormones, and age, other factors you could influence include obesity, blood glucose, exercise, and diet, which impact your prostate health directly. In this video, we will examine the best evidence for a healthy diet that might prevent your prostate from growing further and causing you urinary symptoms. Let's dive in. High-protein diet. A study of over 3,000 men with enlarged prostate that were followed up for 8 years found that total protein intake was positively associated with prostate enlargement. This was slightly stronger for animal protein intake than for vegetable protein intake. Therefore, it is not recommended to consume excess animal protein to increase your total protein intake. Instead, plant-based protein and cold water fish-based protein sources in moderation are probably reasonable choices until stronger evidence emerges. Plant proteins combined with aerobic exercise may be even more beneficial for prostate health than is protein from animal foods, such as meat, poultry, and eggs. Another study reported that daily aerobic exercise, along with a low-fat, high-fiber diet consisting of whole grains, fruits, and vegetables, can reduce factors associated with prostate enlargement, like the estradiol to testosterone ratio and insulin. Many high-fiber plant foods, such as whole grains, lentils, and beans, are also high in protein. Fruits and vegetables. Fruits and vegetables contain high levels of substances that can fight inflammation, including antioxidants, polyphenols, vitamins, minerals, and fiber. Vegetables appear to have an important role in preventing prostate enlargement. In a large American trial called the Prostate Cancer Prevention Trial, over 4,000 participants were evaluated, and there was a significantly lower risk of prostatic enlargement among men who consumed at least 4 servings of vegetables daily compared with those who ate less than 1 serving daily. Lycopene. Lycopene, a component found in tomatoes, was found to potentially inhibit prostate enlargement and may even improve symptoms in patients who consume 15 milligrams per day for 6 months. Lycopene supplements are safe and well tolerated. Green tea. Green tea has potent antioxidants called catechins, also known as EGCG, which have been shown to destroy certain bacteria and viruses, enhance the immune system, and combat several forms of cancer. The evidence suggests that green tea seems to be useful for the management of prostatic enlargement. One caution to remember about green tea is that it contains caffeine, although at a much lower level than does coffee, and somewhat less than black tea. Caffeine is a diuretic and can stimulate the bladder, causing an urgent need to urinate. On average, 1 cup of green tea has 25 milligrams of caffeine, whereas black tea has nearly twice as much. The decaffeinated version is also available. Zinc. The prostate gland contains a higher level of zinc than most other tissues in the body. There seems to be a decrease in zinc levels in the bloodstream and in the prostate in men with both prostatic enlargement and prostate cancer as compared to normal prostate. Zinc inhibits a hormone called 5-alpha reductase, which is a crucial hormone in converting testosterone to the active form, which is called dihydrotestosterone, which is responsible for causing prostate enlargement. Zinc also inhibits prolactin, which also induces prostate enlargement by making it more sensitive to testosterone. However, excessive consumption of zinc supplement of more than 100 milligrams per day may significantly increase the risk of advanced prostate cancer. Alcohol. Higher alcohol intake may be associated with prostate enlargement. In a 17-year study of over 6,000 men in Hawaii, it was noted that an alcohol intake of at least 700 milliliters per month was directly correlated with prostate enlargement. The association was stronger for beer, wine, and sake, and less for distilled spirits. On the contrary, other studies showed a protective effect of alcohol towards prostatic enlargement, but higher incidence of waterworks symptoms despite this protective effect. Vitamin D. A trial of over 4,000 participants showed an association between vitamin D supplementation and reduced risk of prostatic enlargement. There was a trend for decreasing the risk of prostate enlargement with increasing the dose of supplemental vitamin D. This study, however, lacked data on frequency, dose, and duration of vitamin D use. Further research is needed to clarify those points. Vitamin D is believed to lower prostatic contractility and reduce inflammation. Starch. In a study of over 2,000 patients, a direct association was demonstrated between starch consumption and prostatic enlargement. The main sources of starch in this population were white bread, pasta, and rice. Starch induces a blood sugar response by increasing the levels of serum insulin and insulin-like growth factors. The latter is thought to stimulate the development of prostate enlargement. No association was found for sugars from fruit compared to bread. Saw palmetto. This is the most popular herbal product used to treat symptomatic prostate enlargement. Saw palmetto is native to Florida and has been shown to significantly improve the signs and symptoms of BPH in numerous older clinical studies. One examination of 21 randomized trials involving over 3,000 men demonstrated that men treated with saw palmetto experienced decreased urinary symptoms, less getting up at night, and better urinary flow compared with men receiving placebo. This analysis also showed that matched up with men receiving finasteride, which is a dihydrotestosterone inhibitor, men treated with saw palmetto have similar improvement in urinary symptoms with less side effects. Saw palmetto works by inhibiting dihydrotestosterone from binding to its receptors. It also inhibits 5-alpha reductase, which converts testosterone to the more potent dihydrotestosterone. However, another smaller trial showed no benefit from saw palmetto consumption compared to placebo with 369 participants. Rye Pollen Extract, Sernalton. The main active ingredient in ryegrass pollen is called Sernalton. One review suggested that it improves getting up at night, perhaps subjectively, but no evidence of improvement on functional bladder studies, the so-called urodynamics. Beta-sitosterol. This compound has a similar chemical structure to cholesterol. It is found in pecans, saw palmetto, avocados, and pumpkin seeds. 4 trials involving over 500 men showed that beta-sitosterol improved urinary symptoms by 35% and reduced the retained volume of urine in the bladder after peeing by 24%. However, their long-term effectiveness, safety, and ability to prevent complications of prostatic enlargement are not known. Conclusions. A modified diet of less meat, less simple starches, and more vegetables and fruits contribute substantially to the management of prostate enlargement and urinary symptoms. These types of diets might suppress metabolic pathways that lead to obesity and diabetes, 2 conditions that contribute to the development of prostatic enlargement and urinary symptoms. Saw palmetto could be offered to men with urinary symptoms secondary to an enlarged prostate who would like to avoid the side effects of other medications, but such men should be warned that the benefit is modest at best. Most of the available data on nutrition as it relates to prostatic enlargement are observational and should serve primarily as a guide for informing patients on healthy lifestyle interventions. Such lifestyle modifications may assist in weight loss and stabilizing insulin levels, which modulate the effects of prostatic enlargement and urinary symptoms and have a positive impact on cardiovascular health as a side benefit. This is the end of the video. I hope you found it educational and informative. Please consider sharing and subscribing to help the channel grow. Thank you for watching and see you in the next video.